Good day, ma'am. I am Rospolin B. Perez from BSN 2A. My case scenario is about Mrs. Cruz, who gave birth to a baby girl through cesarean section. Apgar scoring was done 1 minute after birth, with a score of 5. The baby was immediately resuscitated, secretions were suctioned, and oxygen administered. The Apgar score became 8. Before rendering nursing care or performing procedures, always do hand washing. Before you enter the nursery room, be sure that you are in your proper uniform. Wipe the vernix gaseosa using wet cotton balls. In performing cord dressing, clean first the cord of the baby using wet cotton. Clean the base. Then, assuming that this is your cord clamp, clamp the cord 1 to 2 inches from the base. Put betadine on the cord stop. After performing the cord dressing, you can now proceed from getting the anthropometric measurements of the baby. In measuring the head circumference, wrap the measuring tape around the head of the infant. Note it in your record. Head circumference 32 centimeter. Next is your chest, the chest circumference. Leave the baby's head. Wrap the measuring tape around 31. Check the vital signs of the newborn, especially the temperature. In taking the temperature, you do it per rectum. After taking the vital signs of the newborn, you can now dress the infant. Apply terramycin to the eyes of the infant from inner to outer canthus of the eyes. Inject vitamin K at the vastus lateralis of the infant intramuscularly. The other thigh of the infant, inject Hep B vaccine intramuscularly. Inject VCG vaccine at the right arm of the infant deltoid muscle, intradermal. Place the baby at the nursery room. Place the baby in the crib in Trendelenburg position in order to drain secretions. You can now do your charting. The following day, the infant's skin appears yellowish. Expose the infant to goose light as ordered by the doctor for 20 minutes to provide heat. Before breastfeeding, be sure that your breast is clean. Do not use soap in cleaning. Use lukewarm water instead. The best breastfeeding position for CS mothers is the football or clutch hold. In doing this position, place your baby at your side. Make sure that legs of the baby were tucked under your arm. Place the baby on the side where you are going to do the breastfeeding. Use the same hand to support the baby's head, while use your other hand in cupping your breast. This breastfeeding position is done to avoid placing your baby to your abdomen. Breastfeeding pattern should be done every 2 to 3 hours, which is 8 to 12 feedings per day. And stooling of your baby should be 2 to 4 times a day. Gather all the materials needed in bathing the infant. 2 basins for soaping and cleansing, hand towel and towel, Johnson's baby bath, and your baby dresses. Remove the bodies. Check if there is poo-poo. There's none. Always support the baby's head. Start with the head of the infant. Shampoo the baby's head. Get the towel and dry. Now clean the baby's face. Do your hand knitted. Now proceed to the body of the infant. Add soap. Make sure that you do not wet the infant's cord.
These are the prepared infant dressing paraphernalias.
After bathing the infant, make sure that you have prepared the dress. Fold the diaper for it not to touch the cord of the baby. In giving your umbilical cord care, Get wet cotton balls, wet with alcohol, and wipe the base of the cord. In performing umbilical cord care, Mom, you should always remember that the diaper should not be touching the umbilical cord stump. Get a clean cotton ball to clean the area. It is not recommended to use alcohol in cleaning the area. Exposure to air promotes optimal healing. There is no poo-poo. Check for the temperature of the infant. If there is no fever, proceed to bathing the infant.